Hello, everyone. I'm Zachary Pohl, Ecosystem Principal at the VSP Global Innovation Center. And VSP Vision is the largest health-focused vision company in the US. And the Global Innovation Center serves as its lens into the future, identifying and supporting emerging technologies and strategic partnerships that reimagine how eye care and eyewear are delivered to the world. We do this in partnership with Matter. Matter is a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change in healthcare. Since they launched in 2015, they've supported more than 1,000 startups from all over the world, and they have a suite of services that help them at every stage of development. They work with dozens of health systems, payers, and life science companies, helping them collaborate with the right entrepreneurs and innovate more effectively. And lastly, they host events focused on healthcare innovation, bringing people together to be inspired, learn, and connect with each other, such as this one. Today's conversation, the next wave in wearables, is the second into our Lens into the Future series and brings together healthcare leaders and innovators to explore how wearable technology is evolving beyond simple, passive monitoring into your active health partner. The global smart wearable market is projected to grow at over a 15% compounded annual growth rate to $283 billion by 2030, with healthcare applications leading that explosive growth. We'll hear what our panelists actually wear, debate which trends could be overhyped, explore why eyewear might be the next healthcare monitor platform, and where AI is creating new possibilities. Also, to discover which health metrics current devices are missing. And so there's some opportunity there. So with that, let's meet our panelists. Dr. Amy Kruse is the General Partner and Chief Investment Officer of Satori Neuro, a venture fund focused on mental health, neurotechnology, and human flourishing. She leverages decades of experience as a neuroscientist and her prior role as an operator and government program manager to discover transformational companies and addressing the largest mental health, brain health, and wellness challenges. She previously served as the general partner at Prime Movers Labs, leading early stage life science investments in human augmentation and longevity. Rob Milnes is the CEO of Sonda and VO Health Tech, bringing over 30 years of experience in B2C and clinical medical devices and digital health technologies. He has run and advised numerous startups and corporate divisions across cardiology, neurology, women's health, and ophthalmology, with expertise spanning strategy, finance, regulatory systems, and successful exits. Sam Propus is Staff Product Manager at Whoop, where he leads the design and development of member-facing experiences centered on personalization and health insights. He has spearheaded initiatives that translate complex data into actionable coaching, helping members better understand their bodies through metrics like sleep, recovery, and strain. Thank you all for joining us today. I can see all of you have taken yourself off on camera, and it's great to see all of you. Let's begin our discussion. So as an icebreaker, since all of you are at the forefront of wearable innovation, let's go around the room with a quick question. What's the most interesting or unexpected insight you've gained from your own wearable device recently? Amy, I'll start with you.
Yeah, no, I'm for those of you that know me and those of you that don't, I'm a bit of a sleep fanatic. And so, I'm one who's got the Aura, the Apple Watch, sometimes occasionally something else that I'm testing and have really been very much focused on my sleep and really trying to put together the best sleep program for myself as a neuroscientist. Sleep is the number one thing that you can do for long-term brain health. And so it was after a plenty of aura data that I realized I need to go to bed earlier. And so I've been really taking care of myself that way and making sure that I'm getting 7+ hours of sleep a night, and definitely seeing the results from that. So sleep fanatic. So
That's great. Yeah, I totally understand. I also wear the Aura and the Apple Watch, and have recently realized that tea before bed is actually negatively affecting my sleep architecture and my ability to get into deep sleep. Yeah. Rob?
Yeah, I guess it's about heart rate variability recovery. So I'm a runner, and I wish I knew what to do about it, but
Yeah.
at least I'm learning more about my body by doing that.
Yes, totally understand. And that's a perfect segue because from Sam and I's first conversation, and Sam has heard this 4 times now, I've been much more focused on my zone 2 cardio. And so, Sam, I will let you kick us and be the last one to introduce yourself and answer the question.
You're good. Yeah. Thanks, Zach. Yeah, I mean, it's too bad I haven't heard Whoop mentioned yet, but maybe by the end of this, we'll hear more about Whoop. But yeah, biggest thing I've learned, actually pretty similar to Amy. I think I didn't really consider sleep. Well, I always knew it was important and I always really prioritized it, but I didn't really think of it like a workout where you kind of need to. You need to plan for it. You need to kind of see how you A/B test it a little bit. So I think the biggest learning and unlock for me has been sleep consistency. So, if I can get 7 or 8 hours, great. But if it's only 6 or 5, that's also okay. The more important thing that I've been focusing on is when do I go to bed and when do I wake up? And making that as consistent as possible has so many benefits for your circadian rhythm. I'm seeing it with Whoop with my health span, like my physiological age, and how helpful sleep consistency is to that. So can speak more about it later, but for me, that's probably been recently.
Yeah, that's great. I do want to get into that later. Okay, so the first way that I want to get into this is a lightning round where we're kind of quickly answering some questions. And after we do that, we'll get into some more in-depth discussion. But for this lightning round, kind of 30 seconds each, which wearables do you wear consistently? And Sam, I'll keep the ball in your court.
Awesome. No surprise. Whoop, I wear 24/7. Even when I charge it, you actually charge it while it's on you, so you truly never have to take it off. It's always monitoring you at all times. But I wear that all the time. Helps me understand my sleep, like I said before, my recovery, my strain, my stress, all of these different things.
Yeah, the stress one I think is really interesting. Rob?
Yeah, I just wear an Apple Watch. I'm really boring. So, and we'll come on to it, but I'm not sure how much value I derive from it. So that kind of leads towards the fact that maybe I need some more information, and I might get it from somewhere else, or I might actually spend 5 minutes to understand what the Apple Watch is telling me, which I've never really done properly. So yeah, I'm not a Luddite, but I'm kind of not that engaged with the process. So perhaps I ought to be more engaged.
Yeah, and I think that's something that me and Sam we'll get into more, but just being able to provide data, if it's not helping, it's only so helpful. Really being able to drive that behavior change is a challenge, but also one that's very valuable to be able to make happen. Amy, I know you already mentioned your Aura and your Apple Watch. And
I've got my Aura, I've got my Apple Watch, and then when I'm on the road, I use my Apollo Neuro to sometimes help me get back to sleep in the evening, which has been really helpful. They have a feature where if you're very restless, the vibration stimulation will turn back on and help you get into a restful state. So definitely like kind of biohacking on the road right now. I travel a lot. And so while these two are my sort of standbys, I've been adding a couple more things to my travel portfolio to see. I've also been traveling with experimenting with some headphones that have sort of like binaural beats and track your brain and stuff like that. So been playing around with those too.
Yeah, it was fun to see yesterday that we actually are playing with the same thing there.
Yes.
I think, or most people have at least heard of your Apple Watch, your Aura, your Whoop. Apollo Neuro, not so much. Can you spend 30 seconds just to tell people what that is and how the tech is supposed to work?
Yeah, absolutely. So it can be worn like a watch, or it can be just clipped to you. It can also be worn on your ankle. It provides essentially vibration or gentle vibration that stimulates or simulates the sense of touch. And so, as opposed to like a haptic that's in your watch, it's actually essentially tuned to give you frequencies that can help you relax, can help you get to sleep, can help you connect with others, or can sort of rev you up a little bit and give you some focus. So it was actually work that came out of the University of Pittsburgh. Dr. Dave Rabin is the co-inventor of the tech, and they've essentially turned it into a wearable that you can use that way. And so it's scientifically proven. It's been used in a lot of different situations. And now over the last year, they developed this closed loop feature that if you're wearing it at night while you're sleeping and you have it set to sleep, it can actually tell if you're getting restless and turn the vibration back on to help you get back into a more restful state and get you back to sleep. So that's just one sort of closed loop feature that I'm really excited about. So.
Yeah, one thing that I think gets us excited is the closed loop, to be able to provide not only the diagnostic, but then also the therapeutic, and then be able to have that continuous feedback.
Yeah.
Let's stay with you, Amy. What's a wearable trend you think is overrated or overhyped? And do you think a category of wearables that is currently right now won't exist in 5 years?
So this might be a little spicy given that I'm a neuroscientist, but I really have not seen people wanting to wear headbands. I see a lot of headbands in the market, and I just don't think it has like long-term stickiness. I understand the use and utility of it. Certainly there's lots of really interesting research and data around it, but I don't think we've seen consumer adoption of wearing a headband maybe to bed every night or wearing it throughout the day or something like that. That really doesn't seem like it's quite sticky to me. So that's probably one thing that, I just see another one and I kind of roll my eyes a little bit. I was like, oh, another 3 electrodes on the forehead, kind of thing. One thing that I think is really interesting is I have a theory that real estate that we have already given over to wearables, so whether that's earbuds, eyeglasses, rings, watches, or other type of things that we're maybe already comfortable with, I think those are probably the wave of the future. And so those are the things that I'm watching really closely.
That actually probably plays I'm sure the people at Loop are very happy to hear that, because you can almost think of these hardware devices as a platform to be able to fit in more things there. And so being able to already have that place in the market is very exciting for them.
Yeah, for sure.
Sam, I'll give it to you.
Yes. Yeah, it's an interesting question. I think kind of building off of what Amy was saying, in terms of like real estate, the wrist is obviously a pretty, I guess it's good real estate for wearables, in that people are very used to it because of watches, bracelets, you name it. It's a pretty common place, but at the same time, it's actually pretty limited real estate. So even at Whoop, when we think about competition, of course there are literal competition like Garmin and Apple Watch and others, but you could say any watch is also competition. So I think that's an interesting element of like where, where even can you have a wearable? I've seen a recent like earring as a wearable and different things like that. But I guess I get the sense that, yeah, the headband is definitely something that I find hard to like actually, would I actually do that on a day-to-day basis? I've tried CGM patches in the past. I think the key to like what will be used regularly is what's easy to use. And so putting something into your skin that only lasts for 2 weeks, like that's not the easiest thing because you need to rotate it out. So I think I don't know if this is necessarily answering the question, but I think what will have longevity and what will stay is like what's the easiest and least frictionful thing to put on that gives the most value, most benefit. So in a way, I think, whether it's a ring, if it's something on your wrist, having interoperability, can you move it from your wrist to your bicep, from your wrist to your shorts or your shirt to give you full flexibility. If you're at a black tie event and you can't have something on your wrist, what do you do? Or on your, what do you do? So I think optionality and just low friction will kind of be the name of the game long term.
Interesting. Yeah, that's a really good insight. Is optionality to be able to where it makes sense. I've heard, a lot of people, they want to be able to wear their Oura ring, but if you're lifting weights, the Oura ring very much gets in the way and you have to take it off, right? Rob.
Slightly different answer to the question, or maybe a slightly different question being answered.
Yeah.
I don't think we're going to see any of these things disappear necessarily, but I think we're measuring a lot of signals in the wrong place simply because it's convenient. So, so the first product I'm representing here is, OvuSense from VO Health Tech, which is a women's vaginal sensor for temperature measurement. So we're measuring intravaginally because that is a very good place to understand what's happening to core body temperature. Anything sitting on the top of your wrist is probably the worst place physiologically to try and take temperature on the entire body. But we wear it on the wrist because it's convenient. Now, that provides benefits for the vaginal sensor device that I'm talking about, of course, over and above more convenient wearables. But equally, it's not giving you as good a result even as a ring, for instance. So a ring probably gives you a slightly better temperature result to understand ovulation and what's happening between cycles. But the best place for temperature measurement is intravaginally for those purposes. So I think it's much more about understanding what to measure where and why you're measuring it in the first place.
That makes sense. Yeah, that makes a lot of sense. There's a reason that using the fingers as opposed to the wrist is advantageous for tracking certain metrics compared to others, because you're going to get more accurate answers. This third question, and Rob, I'll keep it with you, but people in the audience, please put your answers into the chat. We'll share some of them. What's the biggest behavior change you've personally made because of data from a wearable? And Rob, I know you kind of have a spicy answer for this one that we talked about yesterday. I'll let you answer.
I haven't changed any behaviors.
Yeah.
Data coming from any device, and maybe that's because I don't want to. Other than maybe it's because some of the data is I don't have enough of it, but probably it's because I'm not really getting enough value out of what it's telling me, so that I know what to do that's different. It comes back to the question of HRV, right?
Yeah.
I run, my HRV goes worse, it gets better occasionally, I don't know why. What am I meant to do, right? And I think that behavioral change thing, that's actually the key to the next wave in wearables, is give me information that I can act on, right?
Yes. And let's just get right into that, because that's a perfect segue to stuff that we wanted to talk about later. Sam, what have you noticed has been really helpful for getting Whoop members and customers to be able to actually change their behavior?
Yeah, it's a great question. And I realize I probably made an assumption here that everybody knows what Whoop is, but just in case if you don't, it's a continuous health and fitness monitor that you wear primarily on the wrist, but like I said before, you can actually wear it on your bicep, in shorts, in bras, you name it. But it's measuring your heart rate at all times. And from that, like Rob mentioned, you can get HRV, which is your heart rate variability, the variability between heartbeats, your resting heart rate, skin temperature, blood oxygen, lots of different things, sleep data. But with Whoop, and this is, I'll get to the question in exactly 2 seconds. With Whoop, you can actually journal what behaviors you're doing during the day, at night. And so for me, I fill out that journal every day. And I've been able to see really clearly, basically A/B testing myself, what are the behaviors that if I do it on a given day but don't do it the next day, what behaviors most or least impact how well recovered I am the next day. So like Rob was saying, what impacts my HRV? It kind of seems very random day to day. With Whoop, I've been able to say, all right, I'm taking magnesium at night. I took a hot shower at night, or I took a cold shower in the morning. I had a drink of coffee at this time. I had a drink of alcohol at this time. I had 2 or 3 drinks of coffee, or cups rather. All of those data points, those are all my behaviors in a given day. Being able to log that somewhere and then basically marry all of that behavioral, you could argue subjective data, with my physiological objective data, and then see point blank this behavior, such as, let's say, magnesium before bed, or for me very recently, hot shower before bed, 8% recovery boost for me whenever I take a hot shower before bed. it feels a bit like a game, but that's actually great because if you can gamify doing the better behaviors more often, gamify doing the worse behaviors less often, you're actually able to, one, obviously improve yourself and your life and your performance and your health span, you name it, but also you're actually like changing your behavior. So for me, those sort of behaviors, whether it's, I named a few of them, doing those things more often or less often, that's the rub. But having a platform, an actual way to A/B test yourself, say I did this day, I didn't do this the next day, for me has been super beneficial. And I obviously work at Whoop, but I was a member of Whoop prior to working there. Being able to see that point blank on a page, this increases my recovery, this decreases my recovery, was, I don't know, the connecting of the dots there was magic to me.
Let's go deeper there because there is friction with getting people to journal, especially kind of at the beginning when they haven't been able to see the benefits yet. And then Amy, I know in mental health, getting people to do behaviors like this and keeping your daily active users high and getting people past that first 30 days is essential and very tough. So Sam, I'll start with you, and then Amy, I want to get your thoughts. How do you get people to actually start doing that consistently? Days 5 through 30.
I mean, yeah, it's a great question, and I think it's the type of question that consumer companies or B2B probably as well, but consumer companies have to face this all the time. How do you increase adoption? So when we think about journaling at Whoop, well, first thing right upon waking up in the app, we immediately ask you, we pop up the journal, immediately ask you to fill out the journal. What have you done? So that's like, I think thing one is like, make it very easy in that like, you don't even have to click something. It just shows up, start filling it out. But I think as we look to the future, how do you make that more compelling? Using voice to text would certainly be a way to reduce friction. Being able to just say like, hey Whoop, the way that you say, hey Siri, hey Whoop, I just had a cup of coffee, right? And like that is a way to log the journal, for example. I think third-party data and integrations is a great way to kind of seamlessly pull in information. So maybe if you can connect your calendar and have a workout that's on your calendar synced into Whoop or your platform, and really just, I mean, I guess the theme here is reducing friction, but yeah, you want to make it easy to journal. So how do you do that? Either make it the first thing that you see, you're very easy to access or very easy to execute. So let's say voice, or you can like pull in data from other sources. So I think making the friction low is key. And then second, like it's kind of an ROI calculation, in my opinion. If I'm going to invest by typing into Whoop what I did, what is the return on that investment? What does it do for me? If I'm just typing it in and it's going into a void, it's not really giving me any value. So I think being able to show that value up front, show when you invest by telling me that you took a hot shower, the return is this is the impact it had on your sleep and recovery, is fundamental. So it's a balance of making it easy to do, but also show the value, don't hide it. And I think those are both like really key parts.
Yeah, that all makes sense. Amy, thoughts?
Yeah, really, really agree with what Sam said around returning value to the individual sort of as quickly as possible. I think that's the thing that we've seen that makes things really sticky is that, how tight can that loop be? When it comes to, I'm just going to make a more general comment around kind of neurofeedback and other things like that. Like it's well described in the literature, right? As a neuroscientist and somebody who's worked in human performance for a really long time, we know that neurofeedback works. It also takes a long time and like requires a lot of investment from the individual, right? And so while that is like, clinically described in research and useful, et cetera, my focus right now, I'm really, really interested in non-invasive neuromodulation, sort of like I talked about, with vibration, with Apollo Neuro, but also light, sound. I'm working obviously in clinical spaces as well as consumer spaces, but how can we give someone the experience of a good night's sleep or a refreshed state or a change in mood sort of as quickly as possible? And I think as we move into having these devices be closed loop and modulating our nervous systems again on that continuum, right, from maybe more consumer facing things to more clinical facing things. I think giving people that sense of whether it's an experience, an aha, a relief, will be something that really drives adoption here. And also agree with Sam that integration across these platforms and integration across all of our platforms is going to be really critical, right? Like it would be super cool if when Aura, told me I had a super stressful day, like that could have mapped out against my calendar, because I'm probably pretty sure I knew which parts were super stressful, but going into there and aligning it with so even light touch things, I think, could make some of these things even stickier.
Yeah, maybe I could jump in there as well. So the ObviSense device, as I said, is for measuring temperature intravaginally, and what we give back to our users is a much better understanding of the cycle. And largely the users that use it, because of the inconvenience of it in some ways, are women that are struggling to conceive or who have very variable cycles due to things like hypothyroid or polycystic ovarian syndrome. And we debated for a very long time whether we should get our users to journal. We didn't know whether that was a useful thing.
Yeah.
And what's transpired since we've started doing that, particularly in the version 3 of our software, as I said, the device has been around for about 12 years. Last 3 years or so, providing the ability to tell our app when you've taken a particular drug and the dose of that drug, and in addition, diagnostic tests that are going on at the same time, and matching those to the cycle flags that we're providing back, has really been a really interesting sort of closed loop thing again. So we've got about a 92% average interaction rate with the app on a daily basis. That's phenomenally high, but we've got a very motivated audience to find out more. And so that's how we know we're providing value. We then added in another thing, which is we now basically give you advice based on your condition, or things that the app is finding about your condition through the cycle flags that we're making. And again, we found a very large engagement with that, because finding the first piece of more information is really important to them.
That makes a lot of sense. And Rob, I want to stick with you, because Amy said something where there's convergence in what you're working on. She mentioned light, and the eyes are an extension of the brain. That's why you can detect neurodegenerative issues from the eyes and other things from the eyes, like cardiovascular and metabolic, but your brain health from the eyes and things like that. And you mentioned that or I think it was me who mentioned in your bio that Sonda is focusing on a wearable for the eye. And the website mentions that eyewear is going to be the most comprehensive health wearable. Can you unpack that? Why is that? What's the evidence behind that? What can you track from things like that? And then I do have a follow-up question for you from there, but let's start with that.
Sure, and I hope this ties it back to VSP a bit. So this is a completely different business, fairly obviously for the audience, and one that I got involved with about last year and brought in because of my experience of bringing a complex Class 2 medical device to market as a wearable, right? So the idea, and it's only an idea at this point in time, we've done quite a lot of background clinical work and understanding of it, is to take eyewear, standard eyeglass frames, and to insert cameras in them in order to measure both the surface of the eye and eventually, hopefully, the fundus, so the back of the eye as well. And the eye is useful in a number of ways. There's about 50 conditions that you can diagnose through conditions that are associated with the way in which the eye wears. So glaucoma is a good example of that. You can see the degeneration caused by glaucoma relatively easy if you use correct cameras. The idea to track them on an ongoing basis is quite useful for certain populations. So glaucoma population, diabetic retinopathy, for instance. So these are very specific conditions where you have a diagnosis already, where we are helping you to monitor that condition, or if you have a predisposition to it genetically, you can understand whether or not you are starting down that line. if you catch glaucoma essentially early, you can save up to $1,800 per patient per year. And that obviously, as you move towards blindness, that's when you start to get huge social costs associated with it. So there's some fairly obvious eye-related diseases that you can look at. There's then other diseases, so Alzheimer's, Parkinson's, neurodegenerative diseases that are less obvious as they are progressing in the early stages, that if you could pick them up early, again, it would be very useful. The danger we have there is false positives. So there's been quite a lot of work done on eye tracking associated with Alzheimer's and Parkinson's. And what we don't want to be doing is sending every second person that's wearing this device at the age of 60 onwards along to somewhere to say, you might have Parkinson's or you might have Alzheimer's. That's both very concerning and very dangerous for a health system, because there's no way we could cope with that. So that's some of the challenges that we're facing, trying to get those types of modalities to market. But yeah, very exciting, because there are literally so many eye conditions that you can see, or other conditions that you can see through the eye first.
I have an audience member. Well, we've had a couple of questions about this exact topic, so I'd love to have everybody round robin this one. It comes to health access and equity, and how can these devices be able to make this type of capability or functionality of tracking their own health and improving their own health more accessible to people of lower socioeconomic backgrounds and marginalized communities. Let's start with Amy, and we'll go Sam, and then Rob. I want you to talk about that from both of those companies.
Yeah, no, and I think really, really interesting topic right now. And I think we've seen some really interesting things moving in this space. So one thing I would say is just an increase, what I have seen, as an investor, an increasing investment from employers in employees' health and wellness, right? So, giving them access to or a credit for a tracker or some other type of thing like that has been something that we've really seen, kind of in these trends. Very interestingly, I didn't know this until I did my benefits for, this year, but United Healthcare is our healthcare provider. It turns out if I connect and, track my sleep and do other things like that, it gives me credits that I can use toward a wearable that would be essentially free for me to access. And so that was pretty cool, right? I was like, oh, if somebody hadn't told me that, of course, our benefits provider told us, but I like this trend that I'm seeing towards, giving employees access to these types of things. And I think we're seeing that, as in the businesses that I work with, there's, this obviously direct to consumer component, but there's also this, business to business and employer component that's getting a lot of play. Certainly, acknowledging the fact that these devices themselves are relatively expensive. And I think, most of the folks who are making them now obviously probably appreciate the margins that they have, but also know that, in order to increase scalability, the prices need to come down as well. But I think it's been great that we've seen them in Best Buy and other places that are, more accessible. So just a couple of comments there.
Yeah, it's a great answer. By the way, looking through the Q&A, Tarun, I see your question about reality management. It's great to see you, friend. I hope you're doing well. But yeah, I mean, Amy, he runs a company called Reality Management, which is definitely something worth checking out. I can send you the website after this. Sam?
Yeah, I mean, I think this is a great topic. I think wearables in general have, I'd say they largely skewed towards, if you want to call it the health privileged or those that can pay for it. You could argue that the investment of like $1 a day or less is small, but in the grand scheme like that, it doesn't work for everyone. So I think, how do we make wearables and just the ability to understand your health, making that more accessible to more people, I think is probably going to be the most important thing we can do over time. Because if we're seeing the benefits already for a smaller community of people that are looking at their health and understanding it and then having behavior change as a result, how do you scale that, right? How do you get the entire world on it? So I mean, I think Amy touched on a really important aspect, which is, if there are more, if these companies can prove health outcomes or behavior change, and that actually does impact health outcomes, I think we'll see lots of partnerships sprouting up, if not already, around community health organizations, schools, companies. Definitely, those are probably great starting points. But over time, you could see this in health insurance. You could see this in Medicare. You could see this, value-based care programs. If in a way, it's kind of back to the ROI conversation, but if these programs can, by giving somebody a Whoop and investing Whoop or the wearable of choice, if they can give somebody a tracker to track their health and their sleep and all these things, and they can get back information that they can then use to understand risk, or if they need to provide care based off of what they're seeing, and that can reduce the cost of insurance and the cost of healthcare overall, then the calculation works. But I think maybe that scale hasn't tipped yet because there hasn't been maybe enough data. There haven't been enough tests. There haven't been enough data points for these companies to say, commercially, this makes sense for us to do this, right? Like I think altruistically, everybody would want this to happen yesterday. But unfortunately, it has to make sense commercially. So I think once we can get more data out there to show health outcomes and changes that result from doing this, I think we'll see, whether it's health insurance, Medicare, you name it. I think these types of platforms that are much more far-reaching than a D2C website, for example, or even Best Buy or a wholesaler. I think that's when we'll probably see scale really emerge when it comes to health tracking. I think part of the conversation also is, for the longest time, I think wearables were considered fitness trackers. And I think what we've seen for sure change in the last few years, really since COVID, is people want to see their health and like be able to wear something that tells them something that they need to know, right? Because if your respiratory rate jumped overnight, you probably have a respiratory infection. And that was, I mean, obviously 2020 was a really important time for us to all care about that. And now, obviously, since then. So I think as the market has shifted, not just to be about fitness, but about fitness and health outcomes and health span and how do you be healthier for longer, I think these dominoes will eventually fall. But yeah, we need these bigger corporations and these bigger entities to see that ROI calculation, and it has to work for them. But I would not be surprised if in the next, decade or decades that happens.
Yeah, that all makes sense. I know, at least anecdotally, and I was just seeing some chatter online about people being able to see from their Whoop that their stress scores are starting to go up right before they get COVID, and they make an association there. At least anecdotally, and I've heard that with other wearables. Also, that being able to lower ER visits is just so important for some of these ACOs, VBC-based companies. So that's, for entrepreneurs, definitely an area of opportunity for them as well. Rob, I will pass it over to you to answer from both of your perspectives.
Yeah, I mean, I think there's three themes. So, I mean, answering the direct question as to how we bring more healthcare to particularly lower socioeconomic groups, I think, we've seen in the demographic that we sell to. So we broadly sell with the Ovisense device into the USA, Canada, UK, and a little bit of the EU, right? The socioeconomic background of our purchasers in the United States is across the board, completely across the board. And we started to look into why that might be the case. So our device retails at, $299 top end. You can buy it on a monthly basis. It's starting at around $79. If you're going to an OB, right, that's your alternative if you're struggling to conceive, then you're already $150 out of pocket. Plus you've got to travel there. Plus, what they're going to do is give you a bunch of tests that you may or may not get paid for through whatever insurance you might happen to be on, right? So very interestingly, we don't see that trend in the UK, where there's a, theoretically free at the point of care health system. So you get that first initial contact with your health provider for free in theory. And we don't see that shift. It is, it's a essentially higher socioeconomic group, the wealthy, healthy, right, that are able to afford it in the UK, in the US, across the board. So I think wearables have a place in that when you are replacing something else that is actually more expensive for you,
Yeah.
The second thing is, I think there is a massive distrust, and we've kind of fought this over many years, even with our device, in Ovisense, which is a class 2 medical device, right? There's a massive distrust through the clinical community about what this data, what the information is provided by these devices, and how clinically useful it might be. And that's the third thing, which is actually the reality is very few of us have proved clinical value in the data that we're providing, right? So we spent probably $4 or $5 million in Ovisense just on clinical trials, just to prove clinical value. We've published 13 clinical papers, and we are only just 12 years down the line, knocking on doors and not having them shut in our face, and that's around the world. That's not specific to any particular geography. There is a clinical distrust about what temperature data can tell you about cycles. And you have to show value in avoiding miscarriage, in helping people to understand better whether or not they should be on different meds and so on, right? And I think in a sense, the Fitbits and the early players in these markets have not helped because they very deliberately avoided getting into the medical device world. And I think being a medical device is actually quite important and is not as frightening as some of these companies think, right? And one thing it's done for us with Ovisense is we now have reimbursement. So we are able to get OBs reimbursed for the use of our device as a remote patient monitoring tool, right? And that's an advantage to the class 2 classification and all of the expense and thoroughness that you have to put into the process of getting that device to market. So, I think those three things have to come together in some way for there to be a better delivery of healthcare per se.
Amy, did you have something there?
Yeah, I just wanted to pop in and say, this is something that we've heard across the board is, for individuals kind of collecting their own data, and maybe it's Whoop data, Apple Health data, Aura data, whatever, and going into clinicians and trying to have a conversation about their status or health status based on that. I completely agree. Like there's a lot of pushback in, maybe let's call it the general practitioner, environment around, what to do with that data, what it means. I was on a medicine, my resting heart rate went up. I went in to see my physician for something else. And I was like, my resting heart rate went up. And he's like, And I was like, don't you think that's an issue? Like, I was like, it went up a lot, but it was like up to me to like get back on ChatGPT and try to, figure it out, those types of things. And so I agree. We haven't really connected this, individual driven health and wellness use of these devices, integrated into maybe just our general daily practice care. It's exciting to see, like you said, some of the devices get a little bit more clinical or medical, but at the same time, there's some really basic things that we can track and measure that I would think our physicians would care about, but I'm not sure it fits into their little chart yet. So that would be an interesting question long term.
Yes, very much so. And that's actually a great segue to a question that I wanted to ask you, Sam, which is, what is the most interesting or unexpected patterns that Whoop is seeing from its users? Are there any surprising correlations that have emerged from the millions of data points that you're collecting since you introduced the Whoop 5 just recently?
Yeah, it's a great question. Yeah, there's lots with the millions of data points and journal behaviors that are logged. There's lots of information that we're learning and seeing trend-wise. But I think some of the more interesting ones came out recently, kind of related to circadian rhythm patterns. But I think the statistic or the metric was around morning sunlight and that impact on sleep consistency. So I mentioned that before, when you go to bed, when you wake up.
Yeah.
But we saw members that reported getting morning sunlight as having actually more sleep as a result. So basically, by starting their circadian rhythm or their internal clock with seeing morning sunlight, that somehow, or not somehow, but there's obviously the physiological aspect that I can't speak to because I'm not a performance scientist, but somehow that connects to making sure that your clock is regulated and helps you actually fall asleep and wake up at more consistent times. So for me, that was, I mean, maybe it's not unexpected, maybe that makes sense. But with someone without a science or health background, I guess that was pretty interesting. And then another one had to do with, and I've actually experienced this myself, but this trend was pretty interesting to see around daylight eating. So, with my Whoop, and I'm sure Amy's and others have seen this with their Aura, their Apple Watch, when I have a late meal or a late drink or anything that requires my body to digest, I see in my sleep data that my heart rate, it took a while for it to kind of level out and get to resting heart rate. And actually see it in my stress data as well. My stress at the beginning of sleep is high. So the interesting soundbite, the interesting tidbit there is that when members, and I saw this too, but when you report daylight eating and basically not eating after sundown or basically having an earlier dinner, let's say, people actually had higher quality sleep. Again, not groundbreaking, but I think seeing the data and seeing the trend is extremely important. It's kind of like if you can't manage what you don't measure. So like people like, yeah, if I have a late drink, yeah, I didn't sleep that well. I was like, oh, I had a late meal. Yeah, didn't sleep that well. Or, it's kind of easy to just kind of brush it off. But I think when I saw this data and when I see it in my own data as well, it is it kind of helps you make those micro decisions to change your behavior. And like, yeah, do I need to have that bite of dinner after I put, or that bite of fruit after I put my son to bed? Maybe I don't need to have that bite because that means my last bite of food was at 8:30 instead of at 6:30 or whatever the timing was. So I think from a behavior standpoint, those have been really interesting to see. Morning sunlight and keeping your meals, basically finishing eating earlier in the day. But there's lots of other data patterns that are kind of emerging, especially as you said, with we just launched new hardware, and so there's more insights coming. But those are at least two that I found to be pretty interesting.
Yeah, that is very interesting. Rob, anything from your side that you found? I know Sonda is maybe not relevant here just because you aren't out in the market yet, but with VO Health Tech, anything that you found is surprising it's able to help women?
I guess it wasn't surprising once we analyzed the data, right? But from the outset, we didn't really anticipate that we would get quite such a large percentage of women with one or more clearly and obvious, health problem manifesting in the cycle. So what we've really seen, we pretty much all of the science about temperature and cycle management is about ovulation. So, for 200 years, we've known that temperature rises during the process of ovulation. Some clinicians will tell you it only rises afterwards because it's based on progesterone rise. In actual fact, there's quite a good deal of evidence to show that it rises throughout the process of ovulation happening, which doesn't happen instantaneously. But that's like, 2 to 3 day window maximum of the cycle. But what happens at either end of the cycle was what was really fascinating to us. That's a large part of our clinical data is published on that. And what that's really showing is that acyclical progesterone is extremely prevalent in women that have polycystic ovarian syndrome, thyroid issues, and other pattern-related issues. And we didn't expect to see the effect of meds and change in diet be quite so dramatic for those women, but it's very dramatic. You can change a cycle pattern pretty much from one cycle to the next by knowing exactly what the pattern is to start with and changing your diet to improve the chances of you ovulating in the middle of the cycle and the cycle looking a little bit more normal, i.e., not 55 days, but much more nearer to 30 days. So yeah, it was that extra learning that we had from those particular people that approached us because they were the ones that were most likely to need the device in the first place.
Let's stick with you because we have a lot of people in the audience who are thinking of launching their own healthcare company or in the stages of it, launching their first MVP out into the market. With Sonda, use Sonda Health as an example here. How did you choose which measures to track how do you choose your systems to set up to A/B test what users find valuable, or create theories about what they're going to find valuable, and be able to show that back to the user or ingest that information yourself? How are you thinking about those types of things?
Yeah, I mean, that's a fundamental question, isn't it, about a business per se, but specifically about a wearable device. And it's particularly problematic when what you can do is measure potentially up to 52 different conditions, right?
Right.
So, and it's a fundamental question that's come up in all the pitches that we've made as well, because people don't get it unless you can nail it down to one specific modality, right? So the modalities that make most sense are not those for the worried well, because you're not going to give them very good news. We know that, right? All of these things we're tracking through the eye are bad news. And so if you're giving bad news, what you have to do is give it to people that want that bad news in the first place. And so, I mentioned glaucoma and diabetic retinopathy. Those two things, those groups of people who have a genetic predisposition or have started down that pathway, they really need to know what's happening in terms of progression on a more granular basis than they currently get through an ophthalmologist. So that's why we picked those modalities. It just so happens those are two of the largest potential user groups for this type of device as well. I'm not sure that helps answer the generic question as to what should I focus on for my MVP, but pick one thing, pick two things, don't pick 100 things, probably is what I'd say, and find the use in the data that gets that behavioral change, which is the thing it's been the kind of the theme throughout this discussion, isn't it? Find something that people can really act on, make a change, and have a positive outcome from.
So there's something that you said there which segues really well into one of the questions that we're getting about how we can use wearables to be able to help people with medical issues, not just somebody who's trying to improve their HRV from 48 to 52, but somebody who has low back pain, migraines, and we can kind of stick with migraines actually. And you also mentioned not looking at metrics that are just different than what your gynecologist or your ophthalmologist is looking at, but the same metrics, and being able to provide a more 360-degree view. And so, Amy, when you're thinking about interoperability and being able to help people with medical issues for brain health, how are you seeing the companies that are doing it successfully? Why are they successful?
Yeah. So I think there's two things right now that are really exciting. One is around what I'll call the area of sort of precision psychiatry or precision neuroscience. So really starting to use some of these various data sources and actually establishing metrics, right, for people's moods and behaviors and how all those sort of pieces are fitting together. Not everybody can have a brain scan, right, in an fMRI and kind of get that level of detail. We're finding right now that the same types of wearables, metrics, data sources that you can use to track your stress and maybe, some things around your heart rate variability, galvanic skin response actually correlate to people's moods and behavioral states in real time. And so one of our companies is Field Therapeutics that's been doing that. And what's interesting is they're partnering with pharmaceutical companies and other entities that are really interested in not only having that data, because remember, if you think about mental health and the way it's assessed right now, it's essentially a questionnaire, right? Like somebody fills out the PHQ-9 or the GAD-7. It's completely qualitative, right? And what we're seeing is big pharma's interest in adding quantitative metrics. So they're starting to really establish, how people are reacting to certain interventions and medicines. Now that can be on the big pharma side. It can also be on the neuromodulatory side. And so really excited about, kind of where that's headed. I think, and you probably all maybe think this too, I don't know. Obviously, there's been a lot of interest from larger tech companies that have big healthcare sort of organizations within them. Will there be some consolidation around the sensor types that are out there, I don't know. But it's really interesting to watch because I think there's been a lot of interest from, again, the big five, right? Around these metrics, and especially as they build out their healthcare practices, it's going to be interesting to see how that evolves. But just that comment now.
Yeah, yes, we could definitely go down a rabbit hole on that one. Sam, I'll give you the final question. How are you thinking about, or do you think about interoperability and being able to have this information for members more accessible, whether it's through a longevity-focused clinic, your regular PCP, maybe it's your cardiologist, if you are somebody who struggles with AFib and things of that nature?
Yeah, this is a great question. I actually worked on a few integrations at Whoop, like building a developer platform like developer.whoop.com and integrating with Apple Health.
Mm.
So I have a decent understanding about integrations. And I guess the quick answer is that integrations are hard, kind of full stop. They're even harder when you are trying to do that with EHRs and with other places that have, obviously more regulation, but even just uh, there's just less innovation, let's say, happening there technically or in the back end, if you want to call it that. So I think that's kind of the first, I don't know, difficulty is getting past that hurdle of it's kind of like the sales cycle is longer. It's probably that's the analogy I'm making, but it's longer to actually make those things happen. But getting past that hurdle, let's say, I think the interoperability is huge. Having today, I think there's not all of your data, your health data is super, it's spread out. It's in a lot of different places. The doctor's offices have certain data on you. Your wearables probably collecting certain data, all these different places. So, I mean, I think where the puck is probably going that I would foresee is, as there's more clinical validation happening, as EHR integrations get built, as more partnerships with, as Amy kind of alluded to, like more big pharma partnerships. I think as more of those things start to happen, and I think they'll probably happen, kind of not randomly, but like in smaller pieces, as those things happen, I think the ability for the data to flow will be there, which I guess is thing one. But the data flowing alone isn't really like enough. I think having probably like a standard way that we collect all this or hold it all or some sort of schema that is like normalized and everybody agrees to use this schema, let's say, for your health data. I think that will probably need to happen and it'll probably emerge. Because I think somebody commented in the chat, Whoop is calculating it this way, and your Apple Watch is calculating that way, and the blood pressure that you get at the doctor's office was after you ran there, and you're not calm. And so, like, is that even a good data point? But like, that's its own data point. So like, you have all these disparate, but also maybe different data points measuring the same thing. So I think the first thing we'll need is like a schema or some sort of way to normalize all of this across all these different inputs. But the way that will, alongside that, we'll need more clinical validations. We'll need the EHR integrations to happen, and basically an agreement on both sides of the aisle, if you want to call it that. The entrepreneurial like companies that are building things, and the companies that, let's say the EHRs, or like decide that maybe there's more regulation and it's harder to move quickly there. When those two sides can come together and agree on whether that's how does the data, how's it organized, what is the data that we care about, who has access to it, all the privacy aspects of it. I think those conversations are happening, but I think that's where data interoperability will really become the forefront, because right, like collecting the data is where we're at now, and there's definitely insights happening on top of that, and people are learning and improving and changing behavior. But I think as Amy said, it like, our doctors don't really care about our data, or not necessarily care about it. They don't have access to our Aura or our Whoop or Apple Watch.
Yeah.
So actually connecting those dots is probably the first step, and I think we'll see a lot happen once that happens.
I agree, and hoping that happens sooner rather than later. But with that, we are out of time. So thank you for such an insightful and forward-looking conversation. The work each of you is doing is helping create a future where health management becomes more proactive, precise, and more integrated, just like we were talking about, into our daily lives. And to our audience, thank you for joining us. If you'd like to connect with the VSP Global Innovation Center, you can email us at globalinnovationcenter@vsp.com or reach out directly to me or any one of our incredible panelists. This was the second in our 4-part Lens into the Future series, so please be on the lookout for the next one. And be sure to keep a lookout for the finalist companies of the VSP Vision Innovation Challenge, which will be announced on July 25th. Thanks again, and we'll see you next time.
All right. Thanks,
Rob,
everyone.
Amy, Sam,
Cheers.
thank you.
All right.
Bye, everyone.